The allergies you had for corn was your main allergy. Any product that had corn in it, corn syrup, any kind of corn starch, any corn product, even if it was popcorn or anything that was made with corn. Citric
acid, any byproducts or preservatives.
Or even with perfume that was made with corn kind of fuel, even corn that was in the, like an ethanol or whatever that is at the gas
Ethanol and
station.
gasoline.
So what would happen to you when you had a corn product in the air or you ate something with corn? What would happen to you?
My throat would swell up and I'd have to use an EpiPen. I could not breathe.
And there was a time you used how many EpiPens?
I've used 6. So from 2016, about when all my problems started developing and I could really see the symptoms developing, towards fall of 2016, I ate something that I had eaten before, but I just felt different. I felt weird and I was dizzy and my throat was scratchy and my throat felt like it was swelling and my tongue felt like it was swelling. And I told my mom, I was like, hey mom, my throat hurts a lot. So she looked at my throat, she took a flashlight and looked in there and she's like, that looks really bad. So she's like, just take 2 Benadryl. I took Benadryl and I started passing out, started blacking out. So we were at a theme park. They went and got some EMTs and I got on their little golf cart and went back to their little medical center. And the swelling started going down because of the Benadryl, and I was just so confused. Like, I've never had allergies in my life before this. What the heck's going on? So since then, I have had a strong life-threatening allergy to corn and all corn byproducts, and coming in contact with byproducts would result in needing a byproduct, meaning like cornstarch or even like dextrose, which is in salt, table salt. If I have salt on something, I would have my mouth swell up and have to take Benadryl, and if that didn't resolve, I'd have to use an EpiPen. So I'd have strict avoidance of all things with corn byproducts.
And where are we now?
And now, let's see, I came into contact with a byproduct the other day and didn't realize it till the next day when I read the bag. And
no immediate response, no immediate allergy, no inflammation. What did the allergy only cause respiratory problems? Bleeding gums you had from it?
Yeah, my gums would swell so much they'd start bleeding.
Chest pain?
Yeah, my
TC syndrome?
Yeah, tight C syndrome. It triggered tight C syndrome for me, which swelled up the costeo-cartilage around my ribs, and it swelled so much that it tore my chest wall and started to deflate my lung. The medical response for that was go to pain management. That's what you can do for it. And I was like, that's not gonna work for me. My tight C syndrome is gone since coming to Dr. Herman.
Gone.
I have not had a single symptom with tight C syndrome. Yeah.
Bleeding gums around corn?
Gone.
Respiratory problems around corn? Sore throat around corn?
My throat can get sore if I'm around something like gasoline for a long time, but I even pumped my own gas the other day. So I had been
and that was impossible.
Yeah. Before. I blacked out at a gas station one time walking inside, whereas I was stuck in the middle of nowhere with no gas, and I was like, well, I gotta do something, and I was fine.
Fine, no symptom.
Right.
Little sore throat next day?
Yeah, a little bit, and then it went away.
Nothing major.
Yeah.
You used to get fevers every night?
Yeah, around like 2018, 2019, I was getting fever every single night, and then like my hands and feet would just be like ice, but I'd have like 100-degree fever.
And no more fever?
No fever.
And the ice feeling in the hands and feet?
Gone.
Gone.
As soon as we treated for thyroid in one of the protocols, for me it was thyroid.
And you used to feel blackout when you'd stand up, like a POTS kind of blackout feeling? Are you getting that anymore?
No, I haven't had that in, I don't even remember how long it's been since I've had that, but yeah, I'd stand up and then I'd have to like hang my head over my knees because it's like, oh, I can't see, can't hear anything, oh my goodness, but...
Blacking out, and that's not anymore?
No,
Gone.
not anymore, yeah.
100%?
Yeah, and I can drive fine and I don't have to like worry that I'm going to be dizzy or anything.
And that used to happen when you got dizzy, you couldn't drive.
I'd be like, all right, gotta pull over.
Now you can drive and you can get up and you can walk around and hold a job.
Yeah.
And you are not blacking out.
Right.
And you don't feel that postural changes or making anything happen. We're still dealing with the tachycardia when you stand up, which we're going to resolve 100% too. So that's good. You gained one other symptom that you said was you used to have stomach pain and want to throw up when you would sing, and you're in the church and just singing for yourself. You couldn't, as singing music that you liked, you couldn't sing anymore.
No, I couldn't sing. So I I've sang my whole life, and like I was a part of the like worship team at our church, and I had to quit because it was either a problem with my allergies, and that like being at church around people that had on perfume that I'm allergic to would make it swell and I can't breathe. My tightsies too inflamed that I can't breathe. Or then when it was with the vomiting and stuff, it was too much pressure, my diaphragm pushing on my stomach, and I would throw up. Or I had been throwing up so much that my esophagus is bleeding, and it has been for several days, so now I can't sing at all. And so all of those symptoms have gone away too, and now I'm so thankful. Like I can just drink water, keep it down, eat my food, keep it down, and not worry about like feeling like I'm gonna get beat up by my food later. Yeah.
So you can sing, no more stomach trouble that way.
Yeah.
And your overall for the allergies, you feel like they're gone?
They're on their way. They're
How much
probably
would you
like
say?
80%.
80% gone.
Yeah.
And sustainable 80%.
Yeah,
gone.
sustainable 80%.